I'm Dr. Goodnight, a facial plastic surgeon. I practice in Ridgewood, New Jersey. I'm going to review the 3 competing technologies for non-surgical skin tightening, especially of the face. There's the well-known fractional CO2 laser. It penetrates when set to stronger levels, to maybe to 1.3 millimeters, helps clear up the spots on the skin and sun damage and tightens the skin a little. Then came along the Opus fractionated plasma. It's a little faster, it takes 15 minutes instead of 30 minutes like the other one, hurts a little less, and heals more like in 4 days rather than 5 days, and the downtime as far as the dots are not as obvious. It doesn't actually tighten as much because it doesn't go as deep. It goes at most maybe 1 millimeter. Well, this one we get 1.3. So this one will tighten a little more. This one also creates more heat, which causes more tightening. But this one's a little better for the darker skin because that's not safe on darker skin. And then they have the radio frequency micro needling, which actually can be set to go to the bottom of the skin, 2 millimeters at the most. Give you a nice tightening there because it'll penetrate deeper, get to the bottom of the dermis, or you can even tighten the fascia underneath by going a little bit deeper. So as a result, radio frequency microneedling does give you better tightening than the other two, and it's non-surgical tightening. Now, why does it have to be the Lutronic Genius brand of RF microneedling? It's the only one that ensures whatever you set as far as the depth and energy is delivered. If you set it and you deliver it to thin air like you see in here, you get that error noise. So it only puts in 0.1 joule. Normally it's set for 3 joules per kit. And it makes that noise right there as you heard it. The beep beep lets you know that it did not deliver it. You have to do that same spot again. Press a little harder this time. Make sure the needles go in. None of the other technologies will do that. So what typically happens is the other ones may hurt less because they don't penetrate, but you also get no results with the other ones. Or if you penetrate just part way, then maybe you burn the skin, which is also an unwanted result. So that's why it's Lutronic Genius is the one I'd recommend. Now, what about just purchasing the Lutronic Genius? Now you know which one to purchase. Isn't it just the machine you buy and not the doctor that determines the results? Well, you also have to have experience, especially with something like this. And that's where I can come in. You can let the company train you for the Lutronic Genius. They'll train you at very low, safe settings of maybe 8 joules a pen instead of 70 millijoules a pen. You're not going to get much results. You have to do it 4 times to see any results. And since it hurts a little bit, chances are the patients aren't going to want to do it 4 times. So you want to do it 1 time, you want to make a difference, maybe make them look 4 to 5 years younger with just 1 treatment. I can show you how to do that because that requires a lot of clinical judgment. And now when you do it, because now you're going a little stronger, it's even more uncomfortable, so you need to know how to make them numb. There are several ways to make it numb. The company may recommend the BLT. It's got the benzocaine, lidocaine, and tetracaine. And then you have to say, am I willing to accept the 1 in 3,000 risk of a life-threatening methemoglobinemia, which happens more with benzocaine, 3 times more, but can also happen with tetracaine, but only happens with lidocaine in very high doses. So instead, I would recommend, at least on a regular basis, using lidocaine, and you do it at much lower doses over a small area so you don't get any lidocaine toxicity. Now, how do you make lidocaine make you numb so you can do this when the procedure is going to take 50 minutes and it only makes you numb for 15 minutes? Well, there are tricks. There's ways to do it. Believe it. I do it all the time. Patients are very comfortable. That's a trick I'd be able to show you. And therefore, you're not taking those risks. Now, what's the other things that's important to know? Well, how do you know the skin thickness when you look at somebody? How do you know how deep to go? I like to go 3.5 millimeters when I want to kill fat, but you may kill too much fat. The face may need some of the fat. 2 point. You can also kill the facial nerve or burn the bone if you go that deep. So you have to know by looking, go in there. 2.7 is less likely to injure a nerve unless they're really thin. It tightens the deep fascia, but perhaps you're going to burn fat that's unwanted, so you got to be careful where you're doing that. Even 2 millimeters depth, which is set here, kills a little bit of fat. It's a nice skin tightener where the skin is thick, so I can help you look at it and tell you where 2 millimeters is good, see if there's enough fat to allow that. A safer place to go is perhaps not as deep, but it won't give you as much tightening, so we'll show you. Like in the mid-face, you have different settings. Even 1.8 millimeters will kill a little bit of fat, so you may not want to go there on a lean patient, you may want to go a little less. And then you have 1.5 millimeters. This is nice for skin tightening, but you're not going to tighten any of the deep fascia. And how do you know that the skin's even that thick? You can look at the skin and tell the thickness. Then you can just say, well, I'm always going to go shallow. I'm always going to go, let's say, 1.2 millimeters. But then you're possibly going to get risk hyperpigmentation because anything shallower than 1.5 millimeters might injure, and you can't go as high. So you probably get bad results if you try to do it at 1.2. Now there's places where you have these settings, but I can help you look at the patient and just tell you where the settings are the best at each spot, and specifically for that patient where you should go deeper and shallower. That comes with experience, but I can help you hit the ground running by teaching from day one how to do that. What else is important about these machines? Believing they work. So I can bring any of these machines, I'd recommend Lutronic Genius, to your office. You try it on your patients. I show you how to do it properly, safely, and effectively. Your patient's very happy, says they would do it again, or they want to refer their friend because they already got the results they want. Then you know it's worth your investment. But you need to hit the ground running. You need my help for that, not just the company. So getting great results from the start with the right machine makes it a good investment. Hope to see you soon.